This is the second of two videos on gas, and we'll discuss bloating and gas. There are two sources of air in the stomach and intestines. These are air that is swallowed, usually with food, and the breakdown of food by bacteria or germs in the intestine, which produces gas. Abdominal bloating refers to a sensation of fullness in the abdomen, and flatulence refers to the passage of rectal gas. Some people who complain of abdominal bloating do not have excess gas compared to other people. However, they seem to be most sensitive to even normal amounts of gas compared to other people. Bloating of the abdomen might be due to gas, water called ascites, increase in the size of organs in the abdomen, obesity or extra fat in the abdomen, and intestine obstruction. Some people have weak abdominal muscles and appear to be bloated, especially after pregnancy. They think it is gas, but the bloating and distension disappears when they lie flat, so it is due to weak abdominal muscles rather than gas. In this video, we will only discuss bloating due to gas. If symptoms of gas and bloating occur in less than 30 minutes after eating, the problem is usually from the stomach and can be due to functional dyspepsia, which I will discuss in another video. Another cause is slowdown in stomach emptying called gastroparesis. If symptoms of gas and bloating occur 30 minutes after eating, the problem is usually from the small intestine and can be due to various causes, which I will discuss later, including FODMAP foods, celiac disease or gluten sensitivity, irritable bowel syndrome, etc. Sometimes gas and bloating can occur with constipation. Food that remains for a long time in the intestines due to constipation is broken down by gut bacteria or germs releasing gas. Please visit the video on constipation to learn how to manage constipation. Causes of bloating and increased gas and flatulence include aerophagia, or the swallowing of too much air while eating or drinking, which I have discussed in the first video. Another cause is taking a high FODMAP diet. FODMAP are large carbohydrates that cannot be properly digested in the small intestines and reach the colon, where it's broken down by bacteria releasing gas. Please visit the video on FODMAP to learn more about high FODMAP foods. A diet rich in fatty foods, as these foods stay in the stomach for a longer time, allowing gut bacteria to ferment, causing gas and bloating. Too much fiber in the diet. Too much fiber in the diet. Certain types of fiber are broken down by gut bacteria in the large intestine, releasing gas. Change in the bacterial flora. There are trillions of bacteria in our intestines and are essential for good health. Sometimes there is an imbalance in the composition of these bacteria. This can result in bacteria that increase the breakdown or fermentation of food, causing excessive gas. Small intestine bacterial overgrowth or SIBO. In this condition, there is excessive bacteria within the small intestine, causing breakdown of food by the bacteria with release of gas. Irritable bowel syndrome. bloating is commonly seen in the irritable bowel syndrome. Almost always, the bloating occurs together with abdominal or stomach pain and change in bowel habit like diarrhea or constipation. Other causes include parasites. A common parasite that can cause gas and bloating is a parasite called Giardia. You can see the parasite in a stool sample, and one gets it by drinking or eating contaminated food or water. And this parasite can remain in the intestine for a long time if it's not treated. Then we have celiac disease. Celiac disease is an allergic reaction to gluten, a protein found in wheat. It is rare among Asians unless they have an Indo-Caucasian heritage. These are some of the foods that are high in gluten. And this slide shows that in celiac disease, the lining of the small intestine, which consists of finger-like protrusions called normal villi, is stunted in celiac disease. So there is a problem with the absorption of nutrients. Change in atmospheric pressure, for example, during flying, can also cause bloating and gas. Occasionally, bloating may be a symptom of a heart attack, particularly if there is chest pain or pain radiating to the jaw, neck or back, or sweating and giddiness. Finally, symptoms of gas and bloating could be due to problems arising from the stomach, like functional dyspepsia, which I will discuss in another video. Let's now talk about the management of bloating and gas. Firstly, avoid aerophagia, which is the swallowing of excess air. Please see the video on belching. A low FODMAP diet might help. Please visit video on FODMAP. Reduce the intake of fatty foods. Modify fiber intake. Fiber is good for health, but sometimes too much of fiber can cause gas and bloating. Exercise might help to move the intestines and reduce bloating. Try probiotics for 1 month and see whether there's any improvement. Probiotics are healthy bacteria that help to balance the so-called bad bacteria in the intestines. Try probiotics for 1 month and see whether there is any improvement. Simethicone in combination with activated charcoal. These drugs help to absorb gas from the gut. They appear to be more effective if they are taken together rather than individually. Try a product called Beano. Beano is an over-the-counter product which contains an enzyme called alpha-D-galactosidase and may help in the digestion of high FODMAP foods. However, it has no effect on gas produced by lactose intolerance or fiber. Beano should not be given to people with an inherited disorder called galactosemia. Beano is only available in a few countries. Certain drugs that speed up the emptying of the stomach, called prokinetic drugs, might help. Examples are domperidone and etopride. Sometimes antibiotics help the patient with the condition called small intestinal bacterial overgrowth or SIBO. This sometimes happens after the patient takes a course of antibiotics. But paradoxically, antibiotics can also help in this condition, and the antibiotic of choice is rifaximin, which is not absorbed into the body. Unfortunately, this antibiotic is only available in a few countries. For management of the irritable bowel syndrome and constipation, both of which can cause bloating and gas, please see the relevant videos. Finally, for celiac disease, avoid gluten-containing foods only if the tests show there is gluten sensitivity or celiac disease.